Hello, and welcome to the Pharmacy Times News Network. I'm Nicole Grisano, your host for our Pharmacy Week in Review. The Infectious Diseases Society of America and the Society for Healthcare Epidemiology of America have released updated guidelines for Clostridium difficile infections, or CDI, according to reporting on pharmacytimes.com. Some recommendations seem to mirror previous ones, including a recommendation to discontinue therapy with an inciting antibiotic as soon as possible, use of a private room for patients in hospitals and other institutions, and the importance of personal protective equipment such as gloves and gowns when caring for patients with CDI. However, the updated guidelines do make some interesting and very different recommendations from previous ones. For example, for the first time in 3 decades, metronidazole is no longer recommended as a first-line therapy in adults. Instead, oral vancomycin or fludoxamycin are recommended for 10 days in both non-severe and severe CDI, according to the recommendations. While far ultraviolet C or UVC light is not strong enough to affect human tissue, it can kill microbes and may be able to help fight the spread of influenza, according to a recent report published by the American Journal of Pharmacy Benefits. Since the flu is spread through aerosols, controlling it can be difficult. The new study tested whether far UVC light could effectively kill flu aerosols in a setting that mimics a public space. The authors noted that far UVC light could successfully kill H1N1. This approach may be successful in settings where individuals are susceptible to airborne illnesses, such as schools or airports. Due to the low cost of far UVC lamps, the authors noted that this strategy may be a safe and cost-effective way to limit flu transmission, according to the study. Various studies have explored how social media platforms can help patients cope with a new diagnosis and may affect treatment decisions. A recent study suggests that Twitter may be a useful tool to track adverse events of certain medications, according to a report on Specialty Pharmacy Times. The analysis, which included more than 20,000 tweets, showed that patients are overwhelmingly concerned about less severe adverse events associated with prednisolone, such as insomnia and weight gain. Prednisolone is frequently prescribed to treat inflammatory conditions such as multiple sclerosis and arthritis. Many of these tweets mentioned insomnia, weight gain, and appetite, according to the study. The authors discovered that several tweets mentioned nonspecific events associated with the steroid. These findings highlight how patients are using social platforms to discuss adverse events related to a specific treatment. These results may also suggest that prescribers should educate patients about the less serious adverse events, not only with prednisolone, but all drugs, according to the study. Pharmacists may receive more questions from patients after the Centers for Disease Control and Prevention released a vital signs video that focuses on asthma in children. In the video, CDC officials note that asthma affects about 1 in 12 children under the age of 17 in the United States. The video notes that hospitalizations dropped by half from 2003 to 2013, yet 1 in 6 children still end up in the emergency department from an asthma attack. The video offers pearls such as how to recognize the signs of an asthma attack in children and how to address them. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Nicole Grisano at the Pharmacy Times News Network.